Hi, my name is Anand Patel. I am an assistant professor of medicine at the University of Chicago, and I focus on taking care of patients with blood cancers, including acute leukemias and myeloproliferative neoplasms. Today, I am joined by Ned. Ned, please go ahead and introduce yourself.
My name is Ned Weinshenker. I live in northern Utah, and I was diagnosed with primary myelofibrosis just about 7 years ago this month.
Thanks so much, Ned, for taking the time to be with us. And can you tell me a little bit about how ultimately your diagnosis of primary myelofibrosis was made?
Sure. For a couple of years, my primary care doctor noticed that I had very mild anemia. And in 1976, September, he said, well, maybe we ought to start iron supplementation and see if we can get your hemoglobin up. We did that for a month or two. It didn't help. But during that time, I started having some night sweats and some bone pain. And after he heard that, he said, well, I think we ought to see a hematologist. And I saw a local hematologist here, and he immediately said, oh, I think we need to do a bone marrow biopsy. And I said, okay, when do you want to schedule that? He said, tomorrow. So we did that, and within a week, he called me back and he said, "You have primary myelofibrosis." And at that time, I had no idea what that was. He explained it to me, but I was kind of in a state of shock about that. Um, I decided that I needed to have a second opinion, so I went to a doctor at the Huntsman Cancer Institute in Salt Lake City, and they confirmed the diagnosis. I had about a 50 to 60% JAK2 allele fraction of the JAK2 617F. And I talked to both doctors, and they said, well, let's just watch and wait. And I'm not a person who likes to watch and wait. So I started investigating this disease and found the NPN Research Foundation website and looked, and they had a bunch of information about clinical trials. And I looked at those, and I found one in particular that had results only for 4 patients at that point. It was a phase 1, phase 2 study. But I liked the results so much that I decided to try and get into that study. I found out the only site that was close enough was UCLA, which is a plane ride away from me. But I advocated for myself, and long story short, by February, March of 2019, I was able to get into that study, and I'm now almost 7 years into the study. By the way, I didn't mention spleen, and that's gone from 1,560 down to normal.
That is truly remarkable, Ned. Certainly this is a diagnosis that you've lived with and navigated for several years at this point. Ned, something you mentioned in talking about your myelofibrosis journey is your JAK2 variant allele fraction, or VAF. So the variant allele fraction of a mutation essentially tells us what percentage of that gene actually has the mutation versus the normal copy. And sometimes being able to see where that value is before someone starts treatment and then as they're on treatment can give us indicators beyond some of the more common things we look at, like spleen size or blood counts or symptoms, to really get a sense of, are we impacting the myelofibrosis in maybe a deeper way than just impacting the spleen or symptoms or blood counts.